Is your favorite OBGYN again. Today I'm going to talk about pregnancy and the tests that we do to diagnose things like, God forbid, Down syndrome or certain genetic anomalies. There are many tests available right now. There's something called AFP that has always done. AFP is a marker in the blood, usually done between 12 and 16 weeks. Usually have 2 blood tests. And abnormal AFP can point towards Down syndrome or spina bifida. It does have a high false positive and false negative. So we try to do other tests besides this. The other test is called NIPT, non-invasive prenatal testing. That's also blood test. It's done about starting 11 weeks. That's when we look for the DNA of the fetus in the mother's blood. That's much more accurate, almost 1 in 10,000 could be an error, but we do see a false positive or sometimes false negative on this test. If somebody has a test that NIPT shows abnormal, we have to do something called amniocentesis. That's when they put a needle through the belly and take some fluid from the baby, and they check for the DNA of the baby to confirm. And a lot of time could be a abnormal NIPT or abnormal AFP with a normal amnio. The amnio is 100%. So if you have a normal amnio, you don't have to worry about the other test. Another test that can be done is nuchal lucency. That's when you check the thickness of the baby's neck at about 10 to 11 weeks. We tend not to do that test anymore. It has a very high false positive, and NIPT is good enough to replace that test. Obviously, someone is high risk or older, we might go straight to amnio. Amnio does have a risk. The range of risk is when they put a needle through the amniotic sac, it can break the water, and that would be a pregnancy loss if that happens because it's so early. So that's a risk, and that's why we don't offer to everybody. The other test that could be done also is ultrasound, but ultrasound doesn't necessarily check for genetic anomaly. It only checks for anomaly of the fetus physically. For example, if some baby has a Down syndrome, you cannot diagnose it by ultrasound only. But you can check for cleft lip or anomaly of the organs that can be checked. Also for obviously for where the placenta is and how much the fluid on the baby is and the growth. These are things that we check the ultrasound regularly on the baby and measure the baby. That can be done on a regular basis. But those are the tests that we do to confirm and diagnose genetic anomalies.